This is Kathy. She recently lost her job.
And I had sent in a payment, and now I'm getting a disconnection notice.
Now that she's been diagnosed with breast cancer and can't afford insurance, she's wondering if the next thing she might lose is her life. Help is available.
It'll be all right.
Just not to more than 44. It is now my honor to introduce a special guest. You'll recognize Raina Bass and her family from the ads we just saw. Raina lives in Boonville, Missouri. It's one of the millions and millions of Americans touched by cancer and challenged by our broken healthcare system. Raina is a two-time cancer survivor. The first time she survived cancer without insurance coverage with enormous monetary ramifications for her family. At the time of her second diagnosis, she had insurance, but it was not enough, leaving Raina and her family in debt. She called the American Cancer Society's Health Insurance Assistance Service for help navigating the system. She got the care she needed, but it came at a high cost, her financial stability. The American Cancer Society doesn't think courageous cancer survivors like Raina Bass should have to choose between their health and financial ruin for the people she loves the most. Ladies and gentlemen, Raina Bass.
Good morning. As I was introduced, my name is Raina Bass, and I am proud to say I am a two-time cancer survivor. At the age of 15, when most teenagers are facing the obstacle of what is life, or what am I going to do with my life, I was introduced to the obstacle of was I going to get to live my life. In the summer of 1996, as I was getting ready for my sophomore year of high school, I was diagnosed with ovarian cancer. After accidentally getting kicked in the stomach during a basketball tournament, it was discovered that I had a tumor the size of a grapefruit on my left ovary. At the time, my father was self-employed and couldn't afford health insurance for our family. My mother was a stay-at-home wife, making this impossible for her to cover our family with health insurance also. My doctor removed the tumor as well as my left ovary 3 days after discovering the cancer. After conquering surgery and what I thought to be the hardest situation in my life, at 15 years old, the doctor confronted me about beginning treatment for my cancer that included chemotherapy. I refused, having faith and knowing that God had healed me from my ovarian cancer. After leaving the doctor's office that day, little did I realize the financial troubles that my family would soon have to face. My family began receiving medical bills that would soon overcome and take over my family. My father and mother were left with thousands of dollars in medical debt that is still currently unpaid. 10 years later, at the age of 25, I was diagnosed with thyroid cancer. During the second run-in with cancer, I was working and was covered by two insurances, both from my and my husband's employment. In March of 2006, I had two surgeries, which left me without a thyroid. I currently have no thyroid and pay for medication each month to replace the function of my thyroid. Even with two insurances, in March alone, I received a bill stating I owed from my surgery. Only after I started making $50 payments did my primary insurance decide to go back and pick up the rest of my surgery bill. Once again, my insurance is able to pick and choose what they pay for. The real problems began in August of 2006 when I decided to leave my current occupation and become self-employed and open a Christian daycare. Even though I was still insured through my husband's employment, it wasn't enough. My husband currently works for a company that created their own insurance program. The insurance covers 100% of $3,500 per year for our entire family. Our entire family includes my husband, myself, and my little girl. If the $3,500 is surpassed, which one of my cancer surgeries would have done easily, then we have to pay so many thousands out of our own pocket before our insurance will start to go back and pick up 70% of our medical bills. After researching some of the policies, I have learned that beginning in the year 2008, the company will only go back and pick up 50%. So it's getting worse. As I began exploring more options to pick up another health insurance for more coverage, it was discovered that there wasn't a health insurance alive that wanted to cover me. I made numerous insurance I called numerous insurance companies, many who told me buy as soon as I told them I had cancer. Some representatives told me to call back in 5 to 6 years once I'd been cancer-free for a while. I even had an insurance representative tell me that he too had a thyroid problem. It wasn't a big deal, just say I didn't have it. I had insurance companies tell me that they would look into some policies and return my call. Needless to say, I still haven't heard from them. This is when I contacted the American Cancer Society and spoke with a representative to find help. You know, what hurts the most, more than any kind of medical debt, from being uninsured or underinsured, is that even though I live in this great country, I don't share the same freedoms as other Americans. I can't quit a job without first knowing, does it have insurance? Will it pick up my insurance, or will it pick me up? I can't become self-employed and expect another insurance company to even pick me up. I'm made to feel like an outcast by many, if not most, insurance companies. I've had those individuals in society who've asked me, what are you complaining about? You don't know that much. And to those individuals, I respond, I don't care if I owe $500 or $5,000. When individuals, like so many members of our society, live paycheck to paycheck, $500 looks like $5,000. I feel like I should be shouting to the world that I am a 2-time cancer survivor. Yet I'm being asked by insurance companies to deny having cancer. What is wrong with our society that the very same individuals we should be sympathizing with or helping, we punish for a health issue out of their control? Isn't the battle against cancer or any other health condition in that fact hard enough to fight without also trying to fight the battle of being covered by health insurance? A change has to be made, and health insurance should be awarded to all. I'd like to thank God and my family for the love, support, and prayers that they have made such a hardship and fight a little easier to bear. I would also love to thank the American Cancer Society for the knowledge, research, and information that their organization makes available to our society. But most of all, I'd like to thank the American Cancer Society for everything they represent and believe in. Thank you.
Thank you, Raina. Thank you, Bradley, Dan, Rich, John. We've reached the portion of our program now where we're going to take questions. We also, as many of you know, are streaming this press event on the web, so we will be taking questions from our viewers, credentialed journalists on the web as well. We have a microphone in the room so that people who are watching on the web can hear the questions. So if you would wait for the microphone to reach you and identify yourself, we will start with questions here in the room. Are there any questions for our panel? We'll get the mic over there and identify yourself and ask your question.
Yes, hi, I'm John Reichard with Congressional Quarterly. I was just wondering, you mentioned that you're going to be evaluating presidential coverage proposals, and I'm wondering, there are a certain number of them that are already out there. Have you evaluated those so far, and what have you found?
Dan, you want to take that?
We are actually providing our evaluative tool to folks to look at those particular plans. The American Cancer Society, Cancer Action Network, and the American Cancer Society are nonpartisan organizations, and we do not endorse candidates. And in the same vein, we will not be endorsing candidate plans. I would make the distinction, though, between a candidate plan and a legislative proposal that's actively pending in front of a legislative body, either at the state or the federal level. So we'll put information out for folks to decide on their own what they think of those plans. We'll be providing our evaluative tool, our principles on the website, other things, so people can make their own judgments. We will at some point, if in fact there's an active pending legislative proposal in front of the Congress or in front of a state legislature, we could either come out and support or oppose or stay neutral on those proposals, and so we'll be looking at those as we go. But that's the stance that we're going to take. We're encouraging people, and we're not saying that there's one way to get to reform. There are multiple ways to get to reform, and we will use our tools to evaluate those proposals. But again, we're not going to be endorsing, quote, candidate plans.
Next question. I've got one from the web, Dr.